In conclusion, Mr. Chair, distinguished guests, ladies and gentlemen, I would like to urge all stakeholders to redouble our efforts in the fight against malaria by nurturing and strengthening the RBM partnership.
Governor Gani Ture, for his part, said the theme is just fitting as malaria continues to hinder our development aspirations.
Controlling and preventing malaria requires a collaborative effort from all sectors of the society. No single person or unit can do it alone. Therefore, community leaders can help in great deal in advocacy, social mobilization, campaigns, and showcase the efforts made against combating this disease.
Dr. Samila Jah, who stepped in for the WHO country representative at the event, said the theme "Invest in the Future, Defeat Malaria" reflects the need for firm, accelerated action as the MDG target year of 2015 ever inches closer.
We must not forget that 90% of the 660,000 malaria deaths reported last year occurred in Africa, and that malaria kills one African child every minute. Increased domestic and external funding is needed to ensure that adequate quantities of commodities, including enough long-lasting insecticide-treated nets, insecticides, rapid tests, microscopes, reagents, and anti-malaria drugs are accessible and used rationally. Integrated delivery of anti-malarial actions with maternal and child health, immunization, hygiene, sanitization, and improved housing programs must be expanded in order to defeat malaria.
Balagaba Jahumpa, the Minister of Health and Social Welfare, touched on the importance of investing in the fight against malaria and the health sector in general, making reference to the adage that a healthy nation is a wealthy one.
Here in the Gambia, under the National Malaria Control Program, we have established mechanisms and strategies so that Gambians have access, so that you can be tested for the disease, diagnosed and have treatment against malaria. The National Malaria Control Program have also programs and strategies for treated nets. Therefore, we appeal to Gambians, especially women and children, to use the treated nets. The National Malaria Control Program also has an educational program in order to sensitize the population against the disease.
The health minister, who also applauded the country's leadership for its strong commitment to the fight against malaria, disclosed that his ministry is working on plans to embark on a massive fumigation campaign of swamps throughout the country, all in an attempt to make the Gambia a disease-free nation. Famara Fofana, GRTS.
The seminar of the International Social Security Association, hosted by the Social Security and Housing Finance Corporation, came to an end today. The high-level convergence which attracted participants from various African countries came up with strategies that could better the life of people working in industries. Abdullah Baji reports.
Has been playing host to a two-day seminar organized by the International Social Security Association on the theme Work Accidents and Occupational Diseases in Africa. The seminar, under the auspices of the Social Security and Housing Finance Corporation, brought together participants from various African countries. The meeting was intended to formulate strategies that would promote and protect workers in industries against accidents and occupational infections. The closing ceremony witnessed the signing of a statement developed by the participants from the various countries, outlining key strategies which, if implemented, would better the lives of individuals working in industries. The Banjul statement, according to the Vice President of ISA Technical Committee, is one that would complement the Seoul Declaration on Health and Safety, saying it would give full support by harnessing resources in avoiding accidents.
Insurance is key, because without insurance, there won't be any compensation. That was why the government set up the Industrial Injuries Compensation Scheme, to ensure that people who suffer from injuries at work or accidents at work are sort of compensated with respect to the level of injury they have suffered. So it is key that people are insured against risk at work.
Insurance is key to employees, especially those in industries who often suffer from injuries and accidents. Insurance, according to the Vice President of the ISA Technical Committee, will duly aid in compensating those who face such incidents during work.
The Banjul statement basically gives support to that declaration in terms of health and safety, accidents at work, how we will be able to harness resources into bringing about safety at the workplace.
Delivering the official closing remarks, the Managing Director of Social Security and Housing Finance Corporation highlighted that the seminar will also aid in mainstreaming social security accidents in the informal sector so as to reduce accidents. The seminar, he pointed out, also served as a medium of information and experience sharing amongst the participating countries.
The seminar also addressed the challenges in mainstreaming the social security activities in the informal sector to minimize workplace accidents. This sector usually is overlooked in many places, especially in Africa, but if well organized, we know that it can form a big chunk of the scheme. We also exchange experiences as to how, for example, Ghana faces or responds to the challenges in the informal sector.
The closing also witnessed awarding of gifts to key individuals who have immensely contributed to the success of the seminar. As industrial accidents and infections continue to threaten the lives of industrial workers, the coming into force of the Banjul Statement is expected to serve as a turning point in making industries a conducive working place for personnel involved in the sector. For GRTS News, I am Abdullah Baji.
A 5-day interactive forum for officials of the basic and secondary education and stakeholders is underway in the Upper River region. Reminder reports the bi-monthly convergence called the committee meeting is the monitoring arm of the Ministry for Policy Implementation.
Officials of the basic and secondary education and stakeholders have again gathered in Bassi Region 6 for the coordinating committee meeting, in short, the CCM. The 5-day bi-monthly interactive forum serves as a yardstick for the monitoring of policy implementation, especially at school levels.
It is one of the monitoring tools that we are employing to make sure that we monitor what is going on the ground. It's a place where, apart from looking at what we are doing on the ground, whether the investments that are being made are being found on the ground efficiently and effectively, it also creates the opportunity for all of us at CCM to interact, exchange experiences, learn from each other. And above all, it creates the bond of friendship, the bond of family within the education sector and beyond.
The CCM, which is the monitoring arm of the Ministry for Policy Implementation, was introduced in 2008, and since then, its stance on the promotion of quality education remains visible. Asked how the CCM is able to impact on the attainment of quality education, the Honorable Minister disclosed those recommendations and resolutions reached at previous meetings, as well as best practices, have always been put to good use by schools and regional heads, especially.
When we come to a region, we spend the first 2 days reviewing the minutes of the previous CCM. And during that period, the director and staff of the region where the CCM was held previously report on what actions have been taken as per the recommendations from the CCM in that region. And then if there's progress made, we applaud the regional director and team. If not, we try to find out why. Is it to do with resources? Is it to do with incapacity to do it? In which case, at the central level, we find ways as well as members